Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
With me now in the studio is Dr. Ralf Hartmann. He's head of the Department of Dermatology at the Bundeswehr Armed Forces Hospital here in Berlin. Hello, Dr. Hartmann. Welcome to the show. Allergen immunotherapy. Can this actually cure allergies at all?
Yes, that's possible, especially when it's done very well, and then for the rest of your life you get rid of this allergy.
So it lasts, the result lasts forever?
Yes, what you cannot promise to the patient is that he will not get other allergies. That's possible.
And how does this immunotherapy actually work?
We don't know that in 100%, but we think we train the immune system so that it can handle this pollen, for example.
So it's like getting it bored?
Well, that's one of the things we think why allergies come up worldwide. But even this is not 100% sure.
And what kind of pollens does this immunotherapy work against? Is it every kind of pollen?
Yes, especially grass and tree pollen, but also other allergies are possible to treat with it.
When is the best time to start with the immunotherapy?
We advise our patients usually not to start when the maximum is there. When the season is over, the pollen are not in the air anymore, then start to find out what you have and maybe then start this immunotherapy.
And how long does it take time to go this? For 3 years, 2 years, or how long do you have
The regular time is 3 years.
3 years, okay. And there are different kinds of immunotherapies. One is with injection, actually, and one is with drops and with tablets, which dissolve underneath your tongue. How do you decide which patient gets what kind of therapy?
Yeah, usually we use this skin type with the shots. But in the last years, the others with tablets and with drops came up, and they have very good results. So we see what is the best for the patients that we have.
And it's easier because you can take it at home. You don't, as a patient, you don't really have to go to the doctor to administer the drops.
Yes, that's true. But as I said, the usual thing is to give the shots. The others are good, but not that good. So in a few things you have to say, no, for you is shot the best, and for you maybe the tablet is the best, and for the third patient maybe the drops is the best.
What are the side effects of immunotherapy?
Well, for the day when you get the shot, for example, you have to have not too many sports for 24 hours, not to have too much stress for your immune system.
We got a viewer question from Syria, a question which asked us on Facebook, Husni Matjob from Syria. Are there other methods than just immunotherapy he can try for allergic reactions?
Yes, especially in the last 10 to 15 years, we had much improvement for therapy that lowers the symptoms of allergies. For example, antihistamines and drops for your nose and for your eyes. And as I said, we have a lot of improvements for our patients.
Dr. Hartmann, how helpful is nasal irrigation? Does this really rinse the pollen out of your nose, or does it just flush it right into your sinuses?
No, there is no need to be afraid of that, but it can help a little bit. It's okay to do it in addition.
In addition, so it's not an option for just treating it, you need medication as well?
Yeah, usually yes.
And what do you think of acupuncture? Can you do this as a standalone therapy, or do you need medication as well?
Well, as much as we know, it's not a standalone therapy. In addition, it helps some patients, and then it's okay to do it, but not as the only therapy.
Mm-hmm. I think it's very important to know if you're allergic to anything, or is it just a lingering cold? Because if you're allergic to something, there might be an asthma coming out of it. So how can a patient distinguish between a lingering cold and an allergy?
Well, sometimes it's really not that easy, and sometimes it's helpful to meet an expert and ask him and tell him what you have. And for example, when you visit someone who has a cat and you react allergic, then you know it might be the cat.
Yeah.
But sometimes it's not that easy, so meeting an expert for this can be helpful.
And what does the expert do, actually?
Well, he has a lot of questions, and after doing these questions, he will do skin testing and maybe blood testing too.
And if you're allergic to pollen, do you have any advice for everyday's life?
Well, usually it's always helpful to avoid what you are allergic to. Of course, it's not that easy when the air is full of pollen, but for example, it's not a good idea to drive with an open car when you're allergic to pollen in the summer, for example, grass. So avoid it is a good idea. Having a shower in the evening, close the windows, that's helpful too.
So just to wash it all off?
Yeah.
Right. Mm-hmm. What about smoking or secondhand smoke? Is it dangerous for allergic people?
Yes, that's true, and especially for the children. So if you don't want your children to get allergies later on, quit smoking is a good idea, but doctors always say that.
You're right, yeah. So who's at major risk for developing an allergy in the course of the life?
Well, the major risk is when allergies are in your family. For example, your mother is allergic to pollen, your dad maybe has atopic dermatitis, then your risk as a children is about 80% to get these diseases.
And is there anything you can do to prevent yourself from getting allergic to something?
No, as I said, for your children, quit smoking is a good idea, right. And breastfeeding in the first 4 to 6 months is a good idea too.
Mm-hmm. One thing I'm personally very interested in, if you live in the tropics, where there's only rainy and dry season, does it mean that there's pollen all year around?
No, the plants in the tropics too have their seasons, and so we know this from the tropics, and even more than 1,000 years ago we were talking about, for example, rose fever when roses were there.
Good. Thank you, Dr. Hartmann, for being with us in the studio. Thank you.
Thank you.